Today's topic is my most popular blog of 2014, the real reason for the NCLEX decline. If you have seen your program NCLEX pass rates decline by up to 10% since the difficulty level increased in 2013, welcome to the new normal. This is the average nationwide decline. Passing rates have dropped significantly from an average of 90% in 2012 before this slight difficulty in the logic change to as low as 69% pass rate at the end of 2013. This should be a cause of concern and alarm in nursing education. Heath Ledger, in his last role before he died unexpectedly as the Joker in the Batman movie series, made famous the statement, "Why so serious?" In the same way, as it relates to the NCLEX, why is this test so difficult? The NCLEX has always been a difficult test, but the historical average was still a pass rate of about 90%. Since the essence of the NCLEX assesses the ability of the nurse to situate clinical reasoning to practice, if clinical reasoning is deeply understood and applied to practice by students, the graduate nurse will be in a much better position to apply their knowledge to each clinical scenario on the NCLEX and therefore pass the very first time. So instead of pointing your index finger at the NCLEX for making it too difficult for your students, there are literally 3 fingers pointing back at you. Therefore, ask yourself as a nurse educator if you are emphasizing, intentionalizing, and allowing your students to practice clinical reasoning throughout your program, or instead, is your program content heavy with too much content and too little application? Because of the dramatic nationwide NCLEX decline, I think the answer to this question is obvious. As a whole, nursing education has not made the needed changes to radically transform to better prepare our students for practice. In order to radically transform nursing education, clinical reasoning must be front and center in our nursing curriculum and situated in both the clinical and classroom settings. This is one of the essential paradigm shifts identified by the Carnegie Foundation's educational research headed by Patricia Benner in Educating Nurses, a call for radical transformation. But Educating Nurses was published almost 5 years ago. Though the transformational paradigm changes were clearly presented and proclaimed in this book, including the need to emphasize clinical reasoning in our programs, like most prophetic voices, these needed changes have not been widely embraced and incorporated in nursing education, or the NCLEX passing rates would have remained essentially unchanged today. There is no need to teach intentionally for the test of the NCLEX if your program has embraced and situated clinical reasoning, as well as contextualizing and applying theory content to the bedside where it matters most. Clinical reasoning equals NCLEX thinking, as well as, more importantly, how a nurse thinks. Let's review the definition of clinical reasoning that is described in Educating Nurses. Clinical reasoning is the ability of the nurse to think in action and reason as a situation changes over time by capturing and understanding the significance of clinical trajectories and grasping the essence of the current clinical situation. It is imperative to recognize that when this definition of clinical reasoning is understood and then incorporated in your curriculum, you will inevitably prepare your students for the NCLEX, as the following priorities naturally flow from the essence of clinical reasoning. So let's look at NCLEX and clinical reasoning priorities. Number 1, the context is the bedside. Number 2, application analysis level of comprehension of the content that is taught is required. Number 3, there is not one NANDA nursing diagnostic statement required by the students to remember to situate and identify nurse priorities. Number 4, identify the nursing priority in this scenario. Number 5, rationale or the why of all that a nurse does in practice. Number 6, what is the expected outcome? And finally, number 7, what clinical data is relevant in this scenario and why? To deepen your knowledge of clinical reasoning and its relevance to nursing education, I have prior blogs on the 5 rights of clinical reasoning or Where is the Thinking that can be found on my website, KeithRN. So 2 steps that every nurse educator can take right now, today. Now is the time to make needed changes to not only improve the NCLEX pass rates in your program, but more importantly, prepare your students for professional practice. Though I have numerous resources on my website that are devoted to situating clinical reasoning in nursing education, by doing the following 2 things, you can begin to be the needed change. Number 1, cut your lecture content in half. Take the axe and contextualize your classroom theory with clinical reasoning by using a case study or active learning strategy. I have blank templates that you can create your own case study, or you can purchase them on my website and download from over 15 topics that are currently posted. Number 2, for advanced students, use my template of 14 clinical reasoning questions that situate clinical reasoning step by step in the clinical setting. And these same questions are situated in the case studies, so if the students are using these in your classroom, they can practice the thinking and then apply these same questions in the practice setting. In closing, change is always difficult. But it has been my observation that in nursing education, it can be a challenge to reverse course and avoid the icebergs that are clearly in our path. For the sake of our students, let us not delay to make these needed changes so that they are prepared to pass the NCLEX, but more importantly, be prepared for the rigors of professional practice. Thank you.